Hello everyone, my name is Shannon Carey and I am the Clinical Nurse Program Coordinator for the UCI Forensic Nurse Examiner Program. The research question I was aiming to find an answer to was, quote, is the specialized practice of sexual assault nurse examiners, also known as SANEs, effective to improve prosecutorial outcomes for adult female survivors of sexual assault? The short answer to this question is yes. The evidence supports that SANE and SANE/SART programs improve prosecutorial outcomes as well as improve forensic evidence collection and patient care. Starting in 1992, the Joint Commission realized that sexual assault patients were not being treated appropriately and mandated hospitals to implement policies and procedures in emergency departments to ensure these abuse victims are appropriately identified, triaged, treated, and given appropriate referrals. However, despite this mandate, patients were still waiting between 4 and 10 hours before being seen by a physician. SANEs, or sexual assault nurse examiners, are nurses who are specially trained in all aspects of post-sexual assault care, including crisis intervention, referrals to support services, forensic evidence collection, injury detection methods, and treatment or prevention of pregnancies and STDs. Additionally, care provided by the SANE not only delivers better outcomes for a criminal case, but also improves the survivor's disposition in the acute and post-traumatic stages. I would like to take you all through the details of my comprehensive review of the literature, focusing on results from 3 robust, quasi-experimentally designed studies, which is the highest level of research attainable in this subject area. All 3 studies were able to produce results about SANE programs, despite each study having varying mediating factors affecting the dependent variable, prosecutorial outcomes. The independent variable for each study was similar, being a SANE versus non-SANE intervention. The top graph and the bottom right graph illustrate that the results of their studies demonstrate higher prosecution and conviction rates with statistically significant results, despite the studies having different focuses. The bottom left graph shows a SANE-SART intervention, with SART meaning Sexual Assault Response Team, that usually encompasses cooperation with a multidisciplinary team, including but not limited to law enforcement, SANE, and advocacy. Their findings were marginally significant, with a p-value of 0.054 after controlling for mediating factors. Additionally, 2 of the studies, Crandall and Holetzer, as well as Nugent-Borokov et al., found that the SANEs had the following statistically significant findings. 1. Higher percentage of sexual assault victims consenting to the forensic exam. 2. Utilization of specialized equipment, which allowed for more accurate documentation of injuries. And 3. There was a higher percentage of DNA evidence present in the sexual assault kits collected by SANEs, up to 97%, which is what Crandall and Holetzer found for SANE-only cases. The strengths of these studies were that they utilized quasi-experimental study designs, which is the highest level that can be ethically studied with SANE intervention, because the gain from an experimental design, such as a randomized control trial, does not outweigh the risk to a victim's health and well-being. Also, the same intervention, implementation of a SANE, was examined with a similar method across all 3 studies, though the Nugent-Borokov et al. Study reviewed SANE only as well as SANE-SART programs. Additionally, the retrospective analysis was coupled with heterogeneous sampling covering different geographical regions across the United States, making the conclusions applicable to a large portion of the U.S. Overall weaknesses or limitations that were present for these studies were mediating factors such as victim participation, victim-offender relationship, prior arrests of suspect, seasonality, and prosecutorial election years. Additionally, quasi-experimental research designs are prone to history and selection threats related to internal validity. While neither Crandall and Holetzer nor Nugent-Borokov et al. Address these concerns with supplemental information, Campbell, Patterson, and Bybee did provide more information as they did investigate the internal validity of their study. Sexual assault is a prevalent public health problem, and care for survivors needs to be better addressed. According to the CDC, 1 in 3 women and 1 in 4 men have experienced sexual violence involving physical contact during their lifetimes. The American Nurses Association Code of Ethics states that nurses have an ethical responsibility to provide patients with high-quality health care which SANEs are able to provide this treatment. There are also opportunities for nurses and folks of any background to acquire more information about sexual assault and therefore better support our community. In California, our penal code states that every county with a population of more than 100,000 must have a SANE-like services, and in counties with a population of more than 1 million, there must be at least one SANE service in a general acute care hospital for each 1 million persons in the county. Right now in Orange County, we have over 3 million people and only one SANE exam site, which is why we are working at UCI to create and open 2 additional SANE exam sites to better serve our county and community.